Good morning. Thank you for joining us today. We know how valuable your time is given the roles each of you play in your communities, especially considering all that you're doing to navigate this pandemic. So we are appreciative of the time you've chosen to share with us for this very important conversation. My name is Jamie Oslowski, and I have the privilege of serving as President and CEO here at Methodist Healthcare Ministries. I regret the circumstances that brings us together, but I'm extremely grateful for the opportunity to share and learn from one another as we all adapt and respond to the crisis unfolding in our communities. We've been blessed to be in partnership with many of the organizations joining us this morning. But for those of you who are less familiar with us, allow me a moment to briefly introduce our organization before I introduce our featured guests and moderator. We do our work in three ways: strategic grant making, partnerships, and direct services. And we serve 74 counties in South Texas, spanning from San Angelo down to the Rio Grande Valley and to Laredo to Corpus Christi. We are the largest private funder of healthcare services for patients without insurance in South Texas. We've been very blessed to have the means to support the work of over 100 South Texas agencies who care for the least served in their communities, thanks in large part to our partnership with HCA Healthcare and co-ownership of the Methodist Healthcare System in San Antonio. Building partnerships through collaboration has been one of our key objectives since inception, and it's critical to advancing our mission. We partner with other agencies and nonprofit organizations through our community engagement work to address the social determinants of health. We partner with churches across South Texas to offer services through our Wesley Nurse Program and community counseling services. And we work with other health advocates as well as local and state government to advance policies that support resilient families and thriving communities. We also provide primary integrated healthcare through clinics we own and operate here in San Antonio, as well as operating 2 school-based health centers in the Schertz-Cibolo, Universal City, and Marion Independent School Districts. Like many of you, this pandemic has forced us to adjust our operations to reduce the risk of exposure to those we serve and our team members. We've been blessed with very strong city and county leadership in San Antonio to guide us through this extremely challenging and ever-challenging situation. I am extraordinarily grateful that Dr. Colleen Bridger offered to share her time and expertise with us today. Currently, Dr. Bridger serves as our San Antonio Assistant City Manager and is the immediate past director of the San Antonio Metropolitan Health District. Before coming to San Antonio, Dr. Bridger was the director of the health department overseeing a small county in North Carolina with a population of approximately 135,000. If anyone understands the challenges of operating in underserved communities with limited access to resources, it will be Dr. Bridger. As a San Antonio Metro Health Director, Dr. Bridger helped to create several local groundbreaking programs, especially those dealing with mental health issues and in addressing adverse childhood experiences, or ACEs, and led the city's trauma-informed care work. In her new role as Assistant City Manager, Dr. Bridger not only oversees the health services for Bexar County's residents, she's also tasked with finding solutions for human services, parks and equity, and even immigration. Dr. Bridger has been instrumental in leading our community through this crisis. We are extremely fortunate and grateful to have her with us today. Dr. Bridger, I want to say personally, thank you for being so generous with your time and the insights you're going to share with us today. And most especially, thank you for your leadership and caring for our community at this critical time. I want to thank you once again for taking the time to join this important conversation. I hope the discussion provides valuable insights to help you lead your communities through this situation. I pray all of you will remain in good health and for God to bless us with the fortitude to help our families and communities recover from this terrible crisis. God bless all of you.
Good morning. This is Jennifer Knowlton. I'm the Vice President of Regional Operations for Methodist Healthcare Ministries. You're going to be able to hear me today, but not see me. I'm going to be your moderator for today. I want to start by thanking Jamie for that welcome and for introducing Dr. Bridger. I also want to take a moment to introduce Xochitl Hurtado. Xochitl is our Chief Operating Officer at Methodist Healthcare Ministries. She's been with us for 7 months, and we're so grateful for her leadership during this time. She has an extended career in healthcare administration in Texas and came to us from the city of Del Rio. She's a native San Antonian, she's an Aggie, and we are blessed to have her. Thank you so much, Sochi. I'm going to hand it over to her in a second, but I first want to give you some question and answer instructions. I want to thank everyone who submitted questions when they registered. We're going to be answering those questions in the Q&A session later today. Additionally, if you have additional questions during this session, you can type them into the questions section on your GoToWebinar panel. If you're not able to see that, go to the orange arrow at the top of your screen for the GoToMeeting. If you click that, it should open the panel up that allows you to see a section where you can it says questions. You can hit that and then type in your question. I will be monitoring those throughout the day, and we'll be able to, I'll ask those of Dr. Bridger and Sochi. So with that, I know that we have a couple of people that are having trouble with audio. We'll be working on that. You can restart the GoToMeeting with audio and sign in that way. We had one member who already did that. So the phone number should be on the invitation, and the webcast is being recorded, and we invite you to share that. I'll repeat that at the end of this. So with that, I'm going to turn it over to Sochi. She's going to welcome Dr. Bridger and open us with prayer.
Yes, thank you, Jennifer, for the lovely introduction. Dr. Bridger, it's so exciting, and what a blessing to have you here with us, even if it is through a technology base. It's just you're being present and being able to share with our partners and even with us as an organization is tremendous. And so we are most humbled and grateful of your time. If we could take a second just to acknowledge God and just give him glory for all things, I'd ask that we could just take a moment to pray. So if you will join me in prayer. Dear Heavenly Father, there's so many things to articulate, even for myself within my heart and my soul. And Lord, if there are things that I don't touch on or acknowledge, I ask that you listen faithfully to our hearts, each of us that are present and maybe even not present, Lord, to those things that we are lifting to you. First, Lord, your word tells us to give thanks in all things. We'd like to give you thanks for technology, Lord. The fact that right now we can't be together to really have this conversation in a format that would be most conducive to what is normal to us. But thank you, Lord, for just allowing us to be able to connect via the internet and the technology that you've created. You allow us to come together to learn from each other, Lord, and really in an effort to just figure out how it is that together we can take care of those in our communities and do the best we can with that. Lord, history tells us that in times like this, your people, your church comes together even stronger to take care of those that are least served. The first hospital, Lord, was created in a circumstance just like this, and we give you thanks for that. Lord, it's also no coincidence that we are experiencing this during the time of Holy Week, during the time of where your son was sacrificed and was resurrected. Your word also tells us, Lord, that you work all things for good. And although we may not understand today, we do want to acknowledge those of us that know you well, Lord, that we continue to lean in on you for comfort and peace, that we grow stronger. Those that don't know you, Lord, that they find you amongst the quiet times or the chaos, that this again is a time where we learn from each other, learn how to support each other. Lord, we're so grateful for so many things, so many blessings that you have bestowed upon us that we take for granted. I ask, Lord, that you continue to bless those that are serving you, that are working hard to glorify you. You bless their families, their work, everything they touch. Anything from the healthcare workers to the policemen to those just in the communities trying to help where they can in the midst of the danger that is before them, this coronavirus, Lord. I ask that you bless those that are still there fueling and providing food to the grocery stores, those that are filling the grocery stores, Lord. all that so some of us may have food. And those that can't, Lord, I ask that you be with them, those that are in need, those that are experiencing loss, whether it be loss of life, of family, or loss of a job, that you walk with them, Lord, and comfort them. There's so much to be thankful, Lord, and so much that we don't understand, but we're just asking you to be with us and guide us through this time. Be with us through this webcast, Lord, and may we feel comforted with the knowledge that we will gain and comforted with each other as we're here through technology. It's in your Son's most precious name we pray. Amen. Thank you. Dr. Bridger, I'm going to hand it off to you to introduce us to your update on the COVID-19. Thank you.
Thank you, Sochi. I appreciate that. Good morning, everybody. The way we've got this set up is I'm going to do some quick slides just to level set, and then the majority of the time will be left for questions and answers. So let's go ahead and get started with the slides. Next slide, please. I want to first cover how COVID-19 is spread, and I know that this is a review for folks. I also want to say that if Sochi and her team wants to share these slides with you after this is over, that's great. It's got some good information, some good resources for folks. One of the items that we have here, and I don't think it works with this technology, is a picture of what it looks like to actually sneeze in slow motion. So when you do get access to these slides, I'd encourage you to click on that link and see what that looks like. But the whole point is because COVID-19 spreads through coughing and sneezing, or close personal contact with somebody who is sick, or touching an object that may have the virus on it, it's really important to limit the amount of those droplets that get out into the world. So definitely sneezing into your elbow, for example, can stop some of those droplets from getting onto hard surfaces and infecting other people. Next slide, please. So we have 6 basic categories of things that we recommend people do in order to reduce the spread of COVID-19. The first one is, one that we hear all the time, and I think people are doing much better these days, is washing your hands. Washing your hands every couple of hours, or when you touch hard surfaces that are not exclusively yours. So that's an important, probably the single most important thing you can do to prevent the spread of COVID-19. I often get a question about which is better, washing your hands or hand sanitizer. If you wash your hands correctly, which is, really getting up a good lather and doing it for 20 to 30 seconds, washing your hands with good old-fashioned soap and water is the most effective way to get germs off of your hands. If you do not have good old-fashioned soap and warm water, then hand sanitizer is a very good second. The next thing, as I mentioned, is to make sure to cover your cough or your sneeze, either with your elbow or with a tissue, and then throw that away, and then wash your hands. And this next one seems to be the hardest one for most people to do, and I guarantee you when I say it, something on your face is going to itch. But avoid touching your face. The most common way that people get illnesses is they have the germs on their hands, and then they touch their eyes because their eyes itch, or they touch their nose, or they touch their mouth, and that's how the virus enters into the body. With COVID-19, it's especially important to avoid close contact with people who are sick. There's been a lot of talk about whether people should wear masks or not wear masks, and the CDC recently issued guidance that everybody should go ahead and wear masks. What people often lose sight of in that recommendation is that they're making that recommendation primarily for sick people. We're finding with COVID-19 that there are some people who, either in the early stages of the illness, don't realize that they're getting sick or don't have the symptoms. And then a very rare percent of people actually have no symptoms at all while they're sick. So covering your face actually decreases the amount of germs that you're able to spread to others. It's not so much about not breathing in other people's germs. It's about keeping your germs to yourself. The other thing is, if you do feel sick, stay home. I'm going to talk in a minute about what the symptoms are for COVID-19. And then clean and disinfect frequently touched surfaces. I know a lot of people have been talking about making sure that they're disinfecting their cell phones a couple of times a day. That is the petri dish of 2020 for sure. But also things like your computer mouse, your computer keyboard. There were a bunch of different people in my office today setting up this webinar, and all of them touched my mouse and my keyboard. And so they've all been really good about making sure to clean it after they're done. Next slide, please. We skipped the slide. Can we go back one? So one of the things that we see with most viruses is that they tend to be seen predominantly among people who are at high risk. And so what do we mean by people who are at high risk? With COVID-19, unlike those of you who were involved in H1N1, COVID-19 very definitely does seem to be showing up more among people over the age of 50 and seems to be more severe in people over the age of 50. It's especially worrisome for us when it gets into a nursing home or a long-term care facility. You know, in the very beginning of this pandemic here in the United States, there was a situation in Washington State where it was in a nursing home. And unfortunately, we're dealing with that here in Bexar County as well. And we had, you know, a situation where a healthcare worker was ill with COVID-19. She took care of people in a long-term care facility. And so far this week, we've had 8 individuals in that long-term care facility pass away from complications from COVID-19. So that's definitely something that if you're not worrying about right now, I'd like to put that on your plate of things to worry about. Also, people with underlying medical conditions. People with underlying medical conditions are more likely to get COVID-19. They're more likely to develop serious illness as a result of COVID-19, and their case fatality rate is much higher. So especially for individuals who are you know, over the age of 50 with an underlying medical condition, they really need to take all the steps possible to protect themselves from being exposed to COVID-19. Next slide, please. So the symptoms of COVID-19 have been a little bit tricky to nail down, and that's been one of the challenges we've had in communicating this message of if you're sick, stay home, because while the majority of people have fever, we've been studying that here in San Antonio, and about 80% of our people who are testing positive for COVID-19 do have a fever. Not everybody has a fever. Slightly under 80% here in San Antonio have identified having a cough, but not everybody has a cough. Pretty consistently, though, what we see in people who are developing the illness pretty seriously is difficulty breathing, and that is what tends to send people to the hospital, and a lot of those people end up on ventilators, and that's what you see in New York City, for example, that they're really struggling to have enough hospital-based resources to handle all of the people who need breathing support. But you can also experience muscle aches or fatigue. And typically what we see is that the symptoms appear 2 to 14 days after you've been exposed to somebody else who has COVID-19. One of the other symptoms that we're seeing, either along with some of these on the list or even just by themselves, we're seeing a pretty significant percentage of individuals dealing with GI symptoms. So a lot of people are like, oh no, I don't have COVID-19. My stomach's just bothering me a little bit. Don't be so sure. And so what we're telling everybody is no matter what is wrong with you, please, if you don't feel well, stay home. And that's a really hard thing for us to do, but that's what's going to slow the spread of COVID-19. So next slide, please. Wanted to give you a snapshot of what's happening in the United States. A note of caution, this map shows total cases as opposed to some sort of rate per population. But you can see Texas is right there with a handful of other states with over 5,000 cases. And, you know, it makes sense. We have one of the largest populations in the United States as well. But if we look at the next slide, you can see even here in Texas, we have over 8,000 cases of COVID-19 that have been diagnosed. I do want to point out, you know, the bigger counties. Harris County has about 1,800 cases. Dallas County has about 1,100 cases. Travis at 500 and Bexar County at about 450. So it's not surprising to see some of our bigger cities having higher numbers of cases. What we've seen across the world is that it doesn't take very much time for COVID-19 to travel from a big city to a smaller city to the rural areas. And so that's what we're especially worried about with some of our rural hospitals already struggling. How do we make sure that they can be prepared to deal with an outbreak of COVID-19? And again, 161 out of the 254 counties in Texas are reporting at least one case. Next slide, please. So you hear people talk a lot during this pandemic about flattening the curve. And I wanted to spend a little bit of time on this because some people believe that if we flatten the curve, that means that, of course, fewer people will die, and that is true, and fewer people will get sick, and that's not quite as true. The whole concept behind flattening the curve is that we want to slow down the transmission of COVID-19 so that as people become seriously ill and need to be hospitalized, we don't inundate the hospital or overwhelm the hospital with all of those individuals who need care. So if we had done nothing and just let the virus take its own course, we would have experienced such a rapid transmission that the number of people getting sick would have overwhelmed our healthcare system, which is what we've seen in other countries. This flatten the curve through the social distancing and other measures that federal, state, and local governments are taking is quite simply an effort to slow down the transmission so that if people do need to be seen by the hospital isn't overwhelmed by those people. Now, one of the things you can see from this chart, however, is that it does extend the duration of the pandemic. And so that's a little frustrating because while you do prevent unnecessary deaths due to overwhelming the hospital system, it does extend the duration of it. And so we have to deal with some of these restrictions and some of the economic challenges for longer than if we had done nothing. Next slide, please. Talking about what are some of the things we've done, I just want to talk real briefly about what the governor did with his executive order and public health disaster declaration. So the governor issued that on March 31st, and it basically mandated that certain non-essential businesses be closed. So if you're not providing food, if you're not providing any sort of like response or medical services or transportation, you're pretty much told, look, or education, you're not essential. So specifically, it meant that gyms closed. Any organization that provides massages was ordered closed. Tattoo parlors, piercing studios, any place where you go to get your hair cut, which I think is a lot of people are really struggling with that now, several weeks in. It also specifically referenced social distancing and said, no matter where you are, no matter what you're doing, whether you're out at the grocery store or at the pharmacy, both of which are allowed to remain open, you need to keep 6 feet or good social distance between you and the other people in that building. And it also extended school closure through May 4th. The governor also put some restrictions on people traveling to Texas from some of the hardest hit states right now. So, for example, people from New York, if they do travel to Texas, will have to self-quarantine for 2 weeks before they're allowed out and about. Same thing for Louisiana. So want to look into this just a little bit more in depth. Next slide, please. So we talk about social distancing. Social distancing feels a little bit to me like when we talk about social determinants of health. It's a concept that some public health folks got together and decided that was a good way to talk about things, that maybe we should have invited some non-public health people into the conversation. But basically, the way that I describe it at its simplest is stick your arms out to your side and make sure that there's nobody in that circle that you can create if you turn around with your arms out. That's how far away you need to keep people from your orbit, so to speak. So every single thing from what the president has said to what the CDC has said to what the governor has said, the focus is on this social distancing, because we know that COVID-19 is spread through these droplets. And if you are having a close personal conversation with somebody, there is a risk that that person, if they are infected, they could infect you. But if you have that conversation with somebody and they're standing 6 feet away from you, the likelihood of you getting infected by them decreases significantly. Next slide, please. The other thing I want to go in a little bit more detail about is, what does essential mean? So here is a partial list of what essential means: healthcare, government, transportation, childcare, especially childcare for people who are working in these essential businesses, construction in order to make sure that our infrastructure remains intact during this pandemic. Financial institutions, so most of them have gone to either just online or one person at a time appointments, and then grocery stores. So those are good examples of things that are allowed to remain open. Employees are expected to go to work or to work from home. Next slide, please. This is the last slide, and when they email this out, this has a nice set of resources for you if you would like more information about either COVID-19 or some of the stimulus bills that have passed and what the details are for small businesses, for renters, for homeowners, and for food. So with that, I have finished my presentation, and I believe Sochi will moderate us through some questions.
Okay, wonderful. This is Jennifer. I hope everyone can hear me. Thank you so much, Dr. Bridger. We had some good questions come in during your presentation, and I'm going to add those to our list. I'm going to start with the questions that were submitted ahead of time. And the first question is actually for Sochi. Sochi, someone on is wondering about the number of people that are sick with COVID-19 in Guadalupe County, Seguin in particular, and they're interested in the number of people that have died in that area.
Thank you, Jennifer. So what we know so far through the health department and local county websites is Guadalupe County has 45 cases and 36 that are currently active. 9 individuals who had tested positive are now recovered, so that's good. And 1 person is currently hospitalized. It is very fortunate right now that we have no reported deaths. As it relates to Seguin, 6 of the 45 cases, excuse me, I'm sorry, Seguin has 6 of those 45 cases that I just reported out on. And the data is as of yesterday. So typically by the end of day, you will see an update for the region or the counties or specific cities. I hope that answers that question.
Thanks, Sochi. Before I ask the next question, I do want to just acknowledge for all of those who are listening and watching, but especially for our communications department who organized this, and Dr. Bridger and Sochi. We are doing this webinar today by maintaining social distancing. We're all working from our various places. I know that you can see Dr. Bridger is, obviously very busy at the City of San Antonio offices. We're doing this from home. You'll forgive us if you hear someone walk through or a dog barking. We're excited to be able to provide this platform this way because we want folks to see how it's possible to remain connected and stay in community and make a difference while we're all working in a different situation. So thank you all for participating in this experiment today. The next question for Dr. Bridger is, we're depleting our stores with immediate needs. Is there any thinking about the 6 months or year-long plan to recover in our South Texas community?
So I'm going to take that question literally to mean our stores, specifically like our grocery stores. And, this is an interesting disaster. It's not like a hurricane where there could be roads closed. There could be struggles to get food from the warehouses to the grocery stores. That is not what's happening. What's happening, unfortunately, is a little bit of a scarcity mentality during a crisis. There are plenty of foodstuffs available in the warehouses. The challenge is that when the grocery stores restock their shelves, people come in and they buy up everything because the last time they came in, they couldn't. So, I think we're doing a better job now. The state of Texas is about in its 4th week of having positive COVID-19 cases. And I think that's when it started to get real for us Texans. But I think we're starting to see more and more grocery stores and other places do have availability, do have milk and bread and meat on the shelves. And people are realizing that they don't need to hoard these items. And I think it's really important to continue to communicate that to our community, that there is no need to hoard any of these items because there is no disruption to our supply chain. There's plenty of information out there that shows that the warehouses are all full, the supply chains are all intact. The only challenge is that people are buying more than they need. And as soon as that calms down, I think we'll be okay.
Wonderful, thank you for that. The next question is related to how, and I think you can answer this related to the City of San Antonio, but it can also inform all of our South Texas communities. What quarantine arrangements are being made for people in homelessness who test positive for COVID-19?
Yeah, we spend a lot of time here in Bexar County talking about what to do with our unsheltered and homeless who are in shelters. And I'm going to break it up into two buckets, basically. So for people who are in homeless shelters who are symptomatic and test positive for COVID-19, here in Bexar County, we have made arrangements for those individuals to go to a hotel and stay in a hotel until they are no longer contagious. Part of that arrangement means that we're also providing them with food and that we're providing them with regular check-ins to make sure that they aren't getting so sick that they need to seek additional medical services. It's really important in a shelter situation that if you do have somebody who tests positive for COVID-19, that they be removed from that population. We've also extended that hotel availability for people who are living in homes where there might be high-risk individuals. So if I'm living at home with my 95-year-old grandmother and I test positive for COVID-19 and I don't have any other place to go, I can work with the city and be put into a hotel so that I don't pose a risk to my 90-year-old grandmother. So that's what we're doing with people who test positive. The other thing that we're working on, and I know a lot of places across the state are working on this and trying to figure it out, is how do you maintain social distancing in a shelter environment? Even when you don't have somebody who tests positive for COVID-19, social distancing is the single most important prevention action that we can take. How do we do that when you have so many people in that environment? And so what we are exploring right now is identifying a hotel where we can move the highest risk individuals from these shelters out of the shelters and place them in hotel rooms with maybe one other person. That reduces their risk of being exposed and reduces the risk that they would pass any sort of infection on to others. So those are the two things that we're working on. The benefit to the fact that hotels are really empty right now is that we have some options that we wouldn't have had in a normal situation. So if you're trying to think this through, think about some of your local hotels as perhaps being a potential location for people who need to quarantine or for people who just need to be isolated from others in order to reduce their risk of getting infected.
Great, thank you so much for that. Dr. Bridger, the next question is also for you. Talk to us about how folks can safely continue to provide services without placing volunteers or even their fellow employees in jeopardy.
Yeah, because when you are essential and you are continuing to provide services, this is a really important question. And some of it's going to depend on what type of service you need to provide. So if I think of it kind of generally speaking, what we've seen a lot of people do is figure out how to do the work they have to do remotely. So like we're doing today, we're all together, but we're not really. So technology, we're all getting better at Zoom and WebEx and Cisco and all of those different connecting technologies. So that's one of the things we can do. Some of the other things we're seeing businesses do, for example, restaurants, you cannot go in a restaurant and sit down and eat. However, you can go through a drive-through. So using drive-throughs, well, typically is not something I recommend because it's not good for the environment. This would be an exception. Folks should use their drive-throughs. Restaurants that don't have drive-throughs are also doing a call ahead, and they will meet you in the parking lot and hand you your food. That's another really good way to do that. Some of the grocery stores are doing the home delivery. especially for immune compromised individuals. That's a really good option for them, not having to go out to the grocery store, having the grocery store come to them. But also let's think about where you need to come in contact with people. For example, we've established some feeding hubs for some of our unsheltered homeless here in San Antonio. And they've set it up in a way where it maintains social distancing, encourages hand washing, and helps provide education to a pretty marginalized population that might not be getting the same access to information as everybody else. So for example, when the hub sets up, it makes sure that people who are waiting in line to pick up their food are spaced 6 feet apart. When they go to the table to pick up their food, they wait 6 feet from the table while the volunteer puts the food on the table. The volunteer then steps back 6 feet and the person comes and picks up their food. So, you know, as long as you're thinking about how can we creatively keep that 6 foot distance between us, that's a really good solution. And then finally, for people like our healthcare workers who absolutely cannot maintain a 6 foot distance, that's where PPE or personal protective equipment like gowns and masks and eye shields come in. They're really critically important. And so that's why we are really discouraging the general public from using surgical masks or N95 respirators, because we want to make sure there's enough of those for our healthcare workers who do not have any choice but to get inside that 6 foot radius of a person.
Great, thank you so much. And that leads to a follow-on question that I'm going to go ahead and put in here. So talking about the takeout food and the delivery of groceries, you know, we recognize that there's no guarantee that the person on the other end that's prepping the food or packing the groceries isn't infected. So what precautions should someone take while they're waiting, while they're taking advantage of these services, but knowing that there still is a potential risk?
So the risk is pretty small, but there is a potential risk. If you think about groceries, for example, if somebody was sick and did, you know, touch the bag that they brought your groceries in, there's a potential there. So the best thing that you can do is make sure that after you've unloaded your groceries from those grocery bags, that you throw those grocery bags away, and then that you wash your hands very well. That will decrease the risk that if somebody who is sick has touched those grocery bags, that you're not then exposing yourself to the virus.
Great, thank you so much. The next question, Dr. Bridger, if a patient is waiting to be tested, what precautions should be taken by that patient?
The guidance we're giving to individuals who are awaiting their test results is to act as if the results are positive until you get the results back. So somebody who's worried that they have COVID-19 and they've gone to get a test should leave that test facility, go home, and isolate themselves from the rest of the family until they get the results back. That individual does not need to go to the grocery store. They do not need to go to the pharmacy. They really should, if they live by themselves, they should take advantage of the home delivery options that are available, or stay in the car and have somebody meet them in the parking lot and hand it through the passenger side window. People who are pending tests should act as if their tests will be positive. And then if their tests are negative, they're fine. They can resume their normal activities. But if their tests are positive, then they just keep doing what they've been doing and isolating themselves from the rest of their family and the rest of the community.
Great, thank you so much. The next question is from an entity that's concerned about, how to keep the doors open, funding ideas to help us keep our employees. And I'm going to ask both of you to weigh in on that. We'll start with Dr. Bridger.
The CARES Act has information specific to small businesses and nonprofits about low interest loans that you can apply for that can be forgivable if you're able to meet certain criteria. And the largest criteria is that you keep your staff employed. So I know, for example, my husband works for a small nonprofit, and they are working with their financial institution to complete the paperwork to qualify for that low interest loan. And that will give them some additional cash during this difficult time and let them figure out what their new normal looks like. So it provides about 2.5 months worth of operating expenses. The worry is that there's not enough money allocated for that. So I do encourage people to get on that right away. That guidance was released on Friday. And I don't know if Sochi, if you want to add anything to that.
No, that's actually the exact comments I was going to make. I know the federal government is not only the CARES Act, but there's also a like paycheck or pay, something around the paycheck focus with the same principles of just making sure the employees stay, paid. I know they're looking at already reimbursing, the organizations or the companies, small businesses that stood up kind of the sick pay bank. And MHM is currently got a team that's working through a lot of, they're sitting on webinars or asking questions for partners and just individuals that might be able to access this so that we might be able to give some guidance to some of our funded partners. So still a lot we're learning about it. But yes, it is highly encouraging to know that we've got a plan at least for individuals to continue to support their organizations and their employees and the timeliness of it, I think is what makes people nervous is how quick is that turnaround. So I'm going to echo your comments that the sooner you can get in. I think they started taking applications either late last week or early this week. So it's important to go ahead and research that. If you've got, a contact MHM, our grants team is working hard to really understand the CARES Act and how we can help facilitate filling the information out, or at least helping understand what the criteria is. So again, I think there's avenues to help support. I know some organizations have gotten real creative. For example, I think like the Emma Hotel has opened up, their little grocery store to try to keep funding, to just a resource again for folks to be able to buy and purchase and keep their employees working. So some of it's just, what can you do that's creative and outside the box? And then if not, then obviously there's funding support through the federal government.
Great, thank you both. That was a great questions. And we have great questions coming in. We're going to do our best. We still have about half an hour to 35 minutes to answer these. So both of you take a sip of water because the questions are continuing to come. The next question is for both of you, and I'm going to start again with Dr. Bridger. What are you doing for lack of PPE supplies?
The state of Texas has done a masterful job of filling the void. I think that there were a lot of states and cities that assumed that the federal or the national stockpile would be rapidly deployed to states and municipalities in the event of a disaster. That did not happen, and it turns out there wasn't as much stockpiled as we had hoped. And so the state of Texas, being the big state that it is, decided to take things into its own hands. The governor brought in a procurement czar, and he has been purchasing PPE from various private vendors and distributing it out to the counties and the cities as we need it. So we have noticed a significant improvement in our inventory of PPE here in Bexar County over the last week as a result of the governor's efforts.
Yes, and as far as MHM is concerned, one of the ways that we really worked on trying to conserve PPE was obviously consolidating 2 clinics into one, with all of our operations coming out of the Wesley Clinic. In addition to that, adhering to the social distance guidelines and just knowing that we were increasing, a risk because we were seeing a potential peak in COVID, positive tests and the increase in potential exposure. We really started working very early on to do as much as we could in a virtual setting. So whether it be via telephone or via a FaceTime telehealth type setting for our patients and our clients. And it's been very effective. We did have up until this week where we were still having individuals come to the clinic to do lab draws, pick up medications if necessary. A lot of that's now being done via a delivery system or being mailed to our patients. So again, I think it's a matter of really just finding ways to make sure you conserve your PPE. There's a lot of great CDC guidelines right now. I know Methodist Healthcare System is adhering to a lot of that and those practices. And so much to Dr. Bridger's point, they feel pretty comfortable that they've got enough PPE to make sure that not only the patients are staying safe, but employees are staying safe as well.
Wonderful. Thank you both so much. Dr. Bridger, the next question is, what is the single most important thing that we should avoid and the single most important thing we must absolutely not fail to do in this season?
So the single most important thing you should absolutely not fail to do is wash your hands. And I don't think anybody would be surprised, but that's what I'm saying. I think the study I saw said about 75% of us Americans do a pretty good job of washing our hands after we use the restroom. But this is beyond just washing your hands when you use the restroom. This is wash your hands every couple of hours. So that's the most important thing that people absolutely must do. And then the thing that they should absolutely not do, I was tempted to say don't touch your face, but what I'm going to say is we're all going to go a little bit stir crazy with these shelter in place orders coming from the president, the governor, and various local elected officials. Please abide by those orders. I know that it's not pleasant, but these orders are going to be lifted once we start to see a significant decline in the number of positives and the number of deaths. And the only way we're going to get to that point is if people do maintain that social distance, do stay away from crowds of people, do stay at home to the extent possible to limit your exposure to others and others' exposure to you.
Great. Thank you so much. The next question, again, I'm going to ask Dr. Bridger to start, and Sochi, if you have something to add, please do. Folks are already thinking about recovery. A number of the questions are coming in, or we're thinking about not only this emergency response, but future recovery. What governing strategy is planned in place for San Antonio and the South Texas area after the impact of this from a health perspective?
Yeah, and we've been talking about this too. I mean, we're nose deep in the response, but we're also trying to keep our eyes on the fact that this is a double whammy, right? We're getting the current wave of COVID-19, and when we start to feel like maybe we've gotten our head above water with that, then we have to start looking for that second wave of the economic impacts and the recession or depression that follows the first wave of infection. And so we're going to have to be really careful. And I know for Bexar County and for South Texas, we have a larger percentage than most other states' communities of people really struggling to make ends meet. And those are the most vulnerable populations when things are good. And when things aren't good, those are the populations that we really need to make sure we don't take our eyes off of. So from a healthcare perspective, you know, it's weird. They're like in that, I heard somebody describe this a little bit like a tsunami. So, you know, right before the tsunami comes in, the water actually recedes. And so you look around and you're like, what tsunami? The water isn't even up to where it normally is. And that's where our healthcare professionals are right now. Our bed occupancy, at least in Bexar County, is at historic lows. And that's because they've taken the proactive step to limit all non-essential surgeries and services. So we've got the fewest number of people in hospitals right now, which is good when they need to serve the growing number of people who get sick because of COVID-19, but it's having a devastating effect on their bottom line. So once they get through that wave of the people who are sick with COVID-19, they're going to be really struggling as well to recover from the financial impact of cutting back on all of those services and having so many empty beds for so long. So we're just going to have to recognize that this is, once we get through the response, the recovery is probably going to take 3 or 4 times as long as the response. And we're going to have to be really strategic about how we invest our limited resources and making sure that everybody is able to access the services that we can provide, and we're going to have to stop providing some non-essential services.
So
I was muted.
yeah,
So go ahead.
I was muted. I wanted to make sure I was unmuted. Talk to myself. So as far as MHM is concerned, we were in the middle of really focusing and getting ready to roll out our strategy and put into effect, looking through that lens of equity, right, throughout the 74 counties. And there's, so many things that still I think are going to overlap with the work that we were getting ready to initiate with the work that is going to be forthcoming. That being said, though, our strategic team really has taken a pause and maybe hit reset a little bit. We're re-engaging Dr. Soma Stout to help us look at things not only now with an equity lens, much to the point Dr. Bridger was making about those communities that really are going to be in need of some significant help on getting back on their feet, but now to do that through this COVID recovery lens. And so as we're positioning ourselves to say, what does that look like? We already knew the strategic plan that we had in place, we weren't going to be able to have any impact by doing it alone. We were going to have to really seek partners and find organizations that have either done it before us or doing it better than we do, and really partner with them on having greater impact. Those are still going to be the approaches we're going to have to take. It really is going to take governmental entities, hospital systems, other organizations nationally and locally to really come together to figure out how do we engage with these communities that are going to know what it is they need and how do we support them in those efforts. So I really suspect more detail around that will be forthcoming, especially from MHM, and we will be working hard with our partners to make sure we're positioning them and ourselves for really the marathon of what is going to be recovery. And it could be 2, 3, 4, 5 years before we see some of these communities really get back to a state of comfortable, something that would be a new normal for them. If not, again, as God's word says, works all things for good. And maybe some cases we're going to see entities that maybe never thought about focusing on South Texas or the regions that we're focused on, really now partnering with MHM to say, let's do more. And maybe we see some of these communities even rise above where we could have done it individually. So, we've got a lot to think about, and we're looking forward to sitting with the right people and having those discussions and rolling out something that really is a recovery for our 74 counties in South Texas. And maybe some of that could be replicated and scaled throughout the nation.
Great. Thank you both so much. The next question is, for Dr. Bridger. It's a bit of a two-parter. So you have folks that are listening today that are in more rural counties where they've either had no cases of COVID-19 diagnosed or just a few. What are the recommendations? When do they start to make changes in their community? And the second part of that is some of these communities are seeing a real difficulty in getting people tested. And when will this change, and what can we do to encourage regional health departments to increase testing?
Okay, so for the first question, basically we don't have any, or we only have a couple cases. When should we worry? Now would be a good time. The good news is the governor issued his order that went in effect statewide, which should slow the spread of COVID-19, especially in those areas where it hadn't gotten a real strong footing. So, but we definitely need people in those communities to help spread the word that this is something that people need to take very seriously. The days of handshakes and hugs are temporarily postponed. So we need to make sure that we're modeling that behavior. And I know here in San Antonio, we transitioned. We were doing handshakes and hugs. We transitioned, and of course, the kiss on the cheek. That's very typical San Antonio. We transitioned away from that, and we were doing elbow bumps. And then we realized, well, that you can't maintain a 6-foot social distance when you do an elbow bump. So then we started doing foot taps. And then we just gave up touching other people completely. And I think that, you know, you could skip that whole progression that we went through in San Antonio and just be like, okay, hi from 6 feet away. That is a really important thing to do to decrease the spread of this virus. And model the behavior that we need to see. Talk to people about, are you washing your hands every couple of hours? Are you disinfecting your phone a couple of times a day? Is anybody else using your computer mouse, et cetera, et cetera? But if you've got one case, you've got more than one case. And I recognize that there are challenges with testing everywhere. They're getting better, but it is if you've got one case, you've got more than that. As far as what to do about tests, that's a real challenge, and we do need to work with the Department of State Health Services and help communicate to them that rural areas do need access to testing. And I think that Methodist Healthcare Ministries can be a really great advocate for the rural communities with the state DSHS to help coordinate maybe testing locations or get the word out that there really isn't adequate access to testing. The only other thing I will say is that an amazing partner here in San Antonio that we were not expecting was the Texas Med Clinics, so the urgent care facilities. So you might have some luck working with urgent care facilities in your communities who are part of a chain. They may have better access to the testing supplies and the ability to get those tests read. And I don't know, Sochi, if you want to say anything else about that.
No, I think you've covered it well. I do know some of the insurance providers are also trying to do their part. For example, I think Blue Cross Blue Shield, as long as you can have a doctor's order and go to Texas Med Clinic, they will waive the copay on your behalf to get the test done, and then obviously your visit. So you might want to even seek out what your insurance providers are willing to do to help offset some of those costs if it's for yourself or employees, you know, and I think take advantage of those where we can.
Great, thank you so much. The next question is fairly, well, I think fairly simple to answer. Dr. Bridger, someone asked, what about attorneys' offices? Are they considered essential? And how, if they are, what are some helpful tips for them as they're interacting with clients?
Yes, they are essential, and most attorneys have gone to just doing either Skype or telephone meetings with their clients. When they do have clients who need to sign paperwork, for example, that can't be done electronically, I've seen some, orchestrations of similar to how I described the feeding hubs, where you're in a big room, you put the papers on the table, you step back, the next person steps up, they sign it with the pen they brought with them, they take the pen back, the attorney goes and gets the paper and uses their pen to sign it and then takes it and processes it. But those same social distancing rules apply, and the same please see if you can use technology suggestions apply, but attorneys, generally speaking, are essential.
Okay, thank you. The next question is, when in your opinion, or those who are doing the modeling's opinion, are we looking at for this virus to end for the most part?
So there's a lot of modeling going on out there, and that's why I smiled, because one of them's going to be right. And I don't know that it's necessarily the smartest one. It might be the luckiest one. So I'm not sure how much value I'm placing in the spaghetti models that we're getting that are predicting number of deaths, when it's going to peak in the different locations. That said, I do think that there's a lot of information that we have learned from watching COVID-19 in other places in the world, and we can make some predictions and we can enter data into a model based on that. But, I think that in Texas, we have not seen the worst yet. I think probably the next 2 weeks are going to be some of the worst when it comes to increasing numbers of cases and increasing numbers of deaths. And then I think as we get on towards May, we will start to see things improve. What we don't know at this point is how long it will take us to get to the actual end of this. And then when we get to the end where, we've gone 2 weeks, so traditionally for public health, if you're dealing with a communicable disease outbreak, the rule of thumb is if you go 2 weeks without a new case, then you can proclaim the outbreak is over. If we apply that same principle to COVID-19, which I think we should, I don't know when we will get there. And what we don't know is if there will be a vaccine developed in time to prevent another wave of infections from happening next season, or what that looks like. So, again, if we think about H1N1, we were able to get through that first wave, and then there was a vaccine developed and incorporated into the annual flu shot. And so we were able to prevent that second wave because people were able to be vaccinated. COVID-19 is not a flu virus, and so it's a little bit more tricky to develop a vaccine for it, but there seems to be some really good progress being made on the vaccine, so we may not have to deal with a second wave if we can convince people to be vaccinated.
Well, you just segued right into our next question. So someone asked if there is a source on the internet that shows progress toward development of a vaccine.
I am not aware of one source specific to development of the vaccine. I will say that my favorite sources are the WHO website, because they are reporting a global perspective. And then, of course, the CDC here in the United States. They seem to have the latest information about the changing recommendations on what needs to happen. But I don't think there's a single repository right now that's covering the vaccination development.
Okay, thank you. That's helpful. Yes, I think the World Health Organization and CDC sites are great sources of information. And remember, again, the state Department of Health Services website is going to be great for updating communities on your current rates.
Yeah.
Someone asked, there was an essential employee in their community. It was at a bank. They could not get tested. The bank is still open. And so how can we advocate for ourselves and our communities in instances where essential employees aren't able to be tested but have symptoms?
Let's talk a little bit about testing. So testing is important because it helps us monitor the extent to which we are seeing new cases, and that helps us be prepared for how does that translate to hospital preparedness, and what do we need to expect, and how long is this going to last, et cetera, et cetera. This is a virus. So unlike strep throat, for example, where you go to the doctor, you get a strep test. If it's positive, you get a prescription for antibiotics. If you get a test for COVID-19 and it's positive, you're going to be told to go home. So even in places where people can't get tests, if they have symptoms of COVID-19, they should go home, and they should not leave their home until it's been 72 hours since they had their last symptom. So I know that that doesn't satisfy the need to be tested, but I think it's pretty good advice in areas where testing is hard to get. If you have symptoms, assume you have it and stay home for 3 days after you're feeling better.
Okay, great. So it's up to individuals and their employers to make sure that they're monitoring and advising folks to stay home.
Yeah.
Great. Thank you so much. Next question is for somebody is a little bit related to that. So if an essential employee is advised to self-quarantine and they're living at home with family members, is there guidance on how those family members should interact or not interact with that person and their own employment or being out in the community?
Yes. So somebody who tests positive for COVID-19 should isolate themselves from the rest of the members in their household. And that's easier said than done. I understand that. And that's why we're seeing so many close contacts, which generally are people who live in the same household, of these COVID-19 positives also becoming positive themselves. So trying to make this concrete. If I am diagnosed with COVID-19 and I'm living at home with my husband and 2 kids, they are presumed to have been exposed to COVID-19. So they will need to be quarantined for 2 weeks and not come in contact with anybody else. They also need to limit their exposure to me on the off chance that they hadn't yet been exposed. So, so somebody who tests positive should try to limit any interaction with anybody in their household, and anybody in that household should also stay at home and limit their interactions with the community so that they don't inadvertently pass it on to somebody else while they're in perhaps the early stages of the infection. Now, this question comes up a lot, and I don't know if this is what you're going to ask me next, but I do want to address it because we dealt with this a lot here. So let's say that I have COVID-19, my husband is quarantined at home, but does not have any symptoms of COVID-19, has not been diagnosed with COVID-19, but out of an abundance of caution is quarantined at home. Somebody who works with him in his office does not also need to be quarantined. The secondary quarantine is not a thing. So he needs to stay away, and if he starts to develop symptoms during that quarantine period, The health department will talk to him about who did you come in close contact with over the last 14 days, and that might cause somebody else to have to go into quarantine. But this prophylactic quarantining of individuals who had a secondary contact with somebody who wasn't positive is not what we're recommending.
Okay, thank you. Yeah, I think that would come up. So the next question is, do we know what kind of numbers, you know, in thinking about flattening the curve, do we know what kind of numbers for positive cases or deaths that we're looking at before we lift the stay home order and have folks return to work?
No, and I think it's less about number of people and more about the amount of time between new cases. So as we start to see the number of new cases decreasing, we start to see the number of hospitalizations decreasing, and we start to see that lengthening of, oh, it's been 3 days since we had a new case. That's what's going to start signaling that it's okay to return to some normal activities. So it's less about, oh, once we reach 5,000, then we'll be good. That's not the trigger point. It's, okay, well, it's slowed down. The hospitals have slowed down. There are fewer people dying, fewer people sick. There's a longer period of time between newly diagnosed. Those are the keys for us.
Okay, that's great. So help us with rumor control. There is a rumor that after venturing out to the grocery store, that we should come home and take off our clothes and shoes, wash them, and disinfect all of the groceries. Can you speak to that?
Yeah. So you should take your shoes off. I don't think you need to disinfect your shoes. Just don't lick them. And you should, there's been a lot of talk about the whole clothing thing. There's no need to disinfect your clothes. Let's assume that you're somebody who's pretty immune compromised and you had to go to the grocery store anyway. It won't hurt for you to take your shoes off and leave them in the garage or outside the front door. Come in the house and change your clothes, and just put your clothes in the laundry basket and wash them with your regular clothes in your regular detergent, and that will kill any potential virus that's there. There's no need to disinfect. As far as the grocery bags go, again, just throw them away, and then after you've put all your groceries away, wash your hands.
Okay, that's helpful. That really helped me. That was a personal, I was interested in that. Leads to the next question. I know that this is still being explored, but do you have an idea of how long the virus lives on hard and soft surfaces?
We have a pretty good idea of how long the virus lives on especially hard surfaces, and it can be found alive for many, many days. What we don't know is how much of the virus you need to come in contact with in order to develop the illness. So I think that's the research that's still ongoing is, yeah, theoretically, you could pick up a piece of DNA of the virus off of my mouse, for example, for 5 days. But if it's just a little bit, is that enough to make me sick? And so that's where we're doing the research to better understand this hard surface phenomenon and why we're being so adamant about people washing their hands.
Okay, thank you. The next question is related to somebody having signs and symptoms, being tested, the test returns negative, but their signs and symptoms worsen. What should that person do?
Call their doctor. And it's really important to say to your doctor, I've had a COVID-19 test and it was negative, because this is a very common virus. COVID-19 is a novel form of this virus, but there are lots of viruses out there that cause similar symptoms, there are lots of bacteria out there that cause similar symptoms. And so to be able to say to your doctor, I've had these symptoms for this long and I had a negative COVID-19 test, will allow him to eliminate that as a possible cause and move on to, all right, well, what else could possibly be going on?
Okay, thank you. There was a question, and I think we can answer this fairly quickly. There is a special needs teenager. They have a caregiver who tests positive for COVID-19. What precautions should be taken?
Assuming that caretaker had recent contact with the teenager, that teenager should be quarantined and monitored for symptoms for 14 days.
And what if there's not an option for them to change caregivers?
I don't know how to deal with something like that. That they really should try to limit the exposure of the caretaker to the teenager. I know in some places they have said for healthcare workers, for example, if a healthcare worker is sick, they have COVID-19, but they have a mild form of the illness and they can still report to work, they could do so as long as they wear a mask anytime they're interacting with patients. So you could extrapolate that logic to that scenario, but I would exhaust every possible option to separate the caregiver from other people as long as he or she is infected.
Okay, thank you. The next question again is an epidemiological question. Do we know when Texas will reach its peak? And the rumor is that we're 2 weeks behind other states.
Yeah, no, we don't know. I think that it's a true statement that we're about 2 weeks behind, like California and New York. And so if the weird thing there though is we enacted social distancing measures more quickly than those two states did. We also have entirely different population density than like New York City, for example. So there's so many different variables at play here that I don't think we can say, oh, well, this is how it happened in New York, so therefore it's going to happen exactly like that here. But I do think that the 2 week estimate is a pretty good prediction.
Okay, thank you. Next question. I think grocery shopping is a concern for all of us, so you may have a couple of these questions, but what about single parents who don't have a choice but to take their child with them to the grocery store when they're shopping? What are your recommendations?
I mean, if you don't have a choice, you don't have a choice. And I think some grocery stores are getting a little bit better at, because for a while they were like only one person can come in from a family. I think they're getting better at being a little bit more accommodating because if you don't have a choice, you don't have a choice. The other thing I think they're getting better at is that home delivery service. So I know I personally have never used home delivery for my groceries because I like to pick out my own cantaloupes. They don't know how to pick them out as well as I do, right? But I think that during this situation, if I were a single mom and didn't have any place for my child to go while I went to the grocery store, I would explore the home delivery option.
Okay, thank you. The next question is related to the signs and symptoms for COVID. You mentioned earlier that a sore throat might be a symptom. Is it a true symptom of COVID-19? What are we learning as we see folks be diagnosed around the signs and symptoms of this disease?
What we're learning is that it's manifesting itself through a multitude of symptoms. So, for example, we had another situation where the first symptom was an earache. We've had folks for whom the symptom was a sore throat. I think the message here is less about the specific symptoms and more about the fact that right now it's critically important that if you don't feel well for whatever reason, stay home.
Okay, thank you. I'm going to ask one final question and then we will be closing it out. Does the drug combination of hydroxychloroquine and azithromycin, is it effective against COVID-19?
There are, there are a number of clinical trials underway to determine whether a variety of different drugs are effective against COVID-19. Right now, there is no definitive answer. There are really smart doctors trying to figure out the best thing to do for their patients. And I think that that's really the way we should leave it right now until we have the results of the clinical trials that are a little bit more clear.
Okay, wonderful. Thank you. Thank you so much to the audience for your great questions. We are keeping a record of these. If there are others that we can answer for you, we'll reach back. This has been recorded. Afterwards, you will get a survey to complete. We ask that you please complete that survey. This will be very helpful to us know how else we can continue to partner together with our community. Dr. Bridger, do you have any closing remarks? And then I'll ask Sochi the same.
No, just, thanks for this opportunity. When I was talking with Jamie and Sochi and others, the fact that my roots are in rural health, really I was excited at the opportunity to be able to help a little bit with sharing information. So thank you for the invitation and for this opportunity.
Thank you. Sochi?
There we go. Trying to again unmute myself. So yeah, I just want to say thank you, Dr. Bridger. I know most of these questions were for you, and what an opportunity to be able to pull us together through technology to give even a little bit of comfort or increased knowledge to our partners, and mostly in the rural markets. Your expertise and the way you are able to articulate something that is incredibly complex, incredibly fast moving and changing is very reassuring for us. So thank you for being a partner for MHM with MHM as we host this, as well as the work that we're going to do together in the future. So we're most grateful for your leadership. May you continue to be blessed. May your family be blessed, and may there be a hedge of protection over you and those that you work with during this season. So thank you very much. Thank you to all of our partners and those that were able to stay with us on this webcast. Again, it's new territory for us, but if this seems to have worked well, maybe we'll do more. And we ask again for blessings over you and protection over your families and the work that you're doing and the individuals that you're trying to care for. God bless you and keep you. And thank you very much for your time and attendance. And Jennifer, thank you for moderating. You did a fantastic job.
Well, thank you. You're absolutely welcome. It was my pleasure. Y'all are wonderful resources of information. Thank you both so much. Again, thank you to everyone who participated. Complete the survey. Feel free to share this with other community members. And we just ask that you all stay in touch with us and one another and stay strong. Have a wonderful day. Thank you.
God bless.